as champion for Memorial, it is a pleasure to be here on campus, and I probably learn more and take away more than I leave with you, but it's always a pleasure for me, and I'm looking forward to learning from, I already learned some things from Donna and your experiences here at the provincial level, and I'm really going to be very intrigued to be listening to Dr. Jong. And this province, I remember, has a reputation of being a leader in e-delivery of health services, has a world reputation for that. So I'm sure Dr. Jong is following in the footsteps of that here. So just picking up the theme, I am Commissioner for the Canada Revenue Agency. Pleased to see some of our employees here. And I'm very proud of this role. The Revenue Agency is an enormous entity. We have 40,000 employees. We collect $436 billion in revenues. We deliver $22 billion in benefits. To a large extent, as Canada's revenue agency, we are in all the major tax fields for both levels of government. It's very efficient in a federation. And we, whether you like us or not like us, it's hard to avoid the revenue agency. We're responsible for thousands of transactions with individual Canadian taxpayers, with Canadian businesses. About 150 million mail transactions to the agency and from the agency in a single year. So it's an enormous operational entity that I represent. And we are the storehouse, the keeper of tax data, which is an awesome responsibility we have as employees, is retaining this data. By law, we need to retain it for 7 years, and safeguarding that because for privacy, it's a constant worry that we have. So I'll simplify, but not dramatically so. And if you roll back the clock roughly a decade, and you imagine the process of filing a tax return, and you know this very well, I'm not thinking, you would of course be mailed out a package, and a package would have your tax form and all kinds of associated schedules and a guidebook. And whether you needed all of those or not, you got it. And you sat down with your trusty calculator and your favorite pen and an eraser. You needed the eraser. And you would do a working copy, and then you would do a final copy, etc. So that you all know. What you don't know, if you're not a revenue agency person, was that envelope would be mailed in by midnight on April 30th, and then it would be coming into CRA's offices. It would hit our mail room. Staff there would slit the envelope, would pull out the contents, flatten it. If there was a check, because God forbid you owed money, the check was immediately routed to a financial institution. The tax form itself was given a coding so it was not lost in the system. We could track it. And then the tax form thereafter, and here I'll oversimplify, but then it went to a key punch operator to enter your tax form into the system. Now, you may have impeccable penmanship, but not all Canadians are renowned for their penmanship, and so sometimes reading what the taxpayer wrote could be a piece of work. And you may be math wizards, each and every one of you, but not all of us are able, to do all of the calculations and avoid a math error. And even then, just as innocently as something that was meant to be written on this line, if it's incorrectly put on this line, etc. But someone sat there and manually entered whatever was on the tax return. At that point, it then enters into the computer system that does the assessment of your taxes and so forth. So I'll sort of end that there. But that was the tax system. Well, it's sort of obvious, or hopefully obvious, that the sooner you can get that tax form into electronic format, you can really speed up the process. And more than just speeding it up, although that's a lot, you can save a whole lot of manual intervention, which is it's time-consuming and it's costly. You can also eliminate a whole lot of error. that you can tell by the story I've just woven. Entry error, errors in trying to read someone's writing, and math errors by people doing calculations themselves. So the extent to which you can take that front end and get it as quickly into a computer base as possible, you're producing a service that is faster, that is cheaper, that is more accurate, and it's greener. And so that's the journey that the revenue agency has been on. Need help. They need information, and they need advice. And in the old model, you would have storefronts with counters. People would go to the counters. You could ask them questions. And probably behind the counter, there was a shelf with all kinds of brochures, tax bulletins, information circulars, etc. That was, I would say, the old model. With the new model, we need to provide people with information, and we need to answer their questions. To the extent that we can, the information we want to put on our website. And that's there. It's accessible 24/7, and it's accessible regardless of where you live. So the website is the home for information. But if you're like me, you have questions about your circumstance. You're not entirely sure you always understand what's there in the written format. You like to talk to someone. And so for us, that's the call centers. Now, the wonderful geography of Canada, when you start here in Newfoundland, the sun travels and ends up over there on the Pacific coast. If you locate your call centers across the geography of Canada, you can provide call center service 17 hours a day. And we do that in the Canada Revenue Agency. We've situated our call centers such that we have 17 hours of service. So again, an excellent kind of service support that is pretty difficult to provide if you were to restrict yourself to a physical counter service delivery mode. So our model very much is moving towards, is moving our caller support to the call centers, and these people are trained intensively to manage the questions, put as much information as we can online, and also put it in formats that different audiences are more receptive to. So for a traditional crowd, there's traditional reading documents, but increasingly we have a whole lot of YouTube videos that are more popular, more accessible for people that prefer to get their information in a video format. And we're increasingly active on things like Twitter and other social media. The Revenue Agency, we opened to Twitter, I think like a couple of years ago, and now we have about 36,000 followers on Twitter, taking tax tips and information from us through the medium of Twitter. On the e-delivery itself, it was 2004 and 2006. That's why I talked about a decade ago, where we opened My Account portals. There are, in fact, three. There's one for the individual, it's just My Account. There's one for a representative, because you probably know for businesses and for individuals, for the most part, people have a representative, a tax preparer, who is doing the registration for them. So there's My Account for representative, and then there's a business account, My Business Account. These are the three main portals. They all have security features. And that's one of the things I'm sure will come up in the discussion, is how can you have the broadest and easiest access to your population, but in a place like the Revenue Agency, have very secure, strong security features to protect against intruders, to safeguard the information, to ensure that when Jane Doe is coming to my account to look at Jane Doe's account, it's really Jane Doe, not someone using Jane Doe's name. So we introduced these accounts. In their first year, there was 4 or 5 things you could do on them, which was read only. That's all you could do in the early things. Since then, we've introduced over 50 functions to my business account, which has the greatest functionality. There are now 52 discrete functions on my business account, a whole lot of transactions that you can do through that portal. We add functions every year. We add functions. There's usually about 2 releases in a year, one in the spring and one in the fall, where we add functions to the account. More and more of our service we can provide through these accounts, and that's the direction that we're going. Some of the latest things include like a "You've Got Mail" function in the business account. The actual ability, this is something that's a very important feature, the ability to actually communicate with the revenue agency and get an answer in the security of your own portal. The notice of assessment, you get the notice of assessment by mail. We certainly want to build that out, that your notice of assessment will be there available for you through my account, just to sort of highlight a couple things. You don't have to have my account to e-file, and perhaps most of you that had your hand up don't. Another wonderful thing about going to e-service delivery is we don't develop the e-filing softwares. We let the marketplace do that. We just put it out and said, develop things. The revenue agency certifies them, and that basically means that if you use that software, the CRA has certified that you get the correct results from that software. Again, over time, we now have about 30 different softwares out there available on the market. You can see them all listed on the revenue agency website, and a number of those softwares are free. They cost you nothing. They are free, and you use those to file. How far have we come? Last year, not the year we're currently in, but last year was a big year for us. That was the year that we stopped mailing each Canadian a big paper tax filing kit. It was a tough nudge to encourage people to e-file, but it was a decision we took to move people in that direction. If you want to file by paper, you can still get it at Service Canada outlets, you can still get it at Canada Post outlets, you can get it by calling CRA, but obviously we're trying to encourage people to use the service delivery mode that is fastest and most effective, and that's e-filing. So last year, following this change, over 76% of Canadians e-filed. 3 of 4 used e-filing. This year, our goal is 80% e-filing, and the last time I looked at the statistics, as I left Ottawa, we were running 82, 83%, so we're certainly within sight of reaching our goal this year. E-filing is not for everybody, although it's the one we encourage, and we still see more uptake in e-services as we encourage Canadians, as we improve our own service delivery offerings. There will always be some people who do not have access, not comfortable with computers, or for whatever personal reason, don't choose to go that way, and we understand there'll always be a number like that. In addition, there are Canadians, low-income Canadians, recent immigrants, others who need a helping hand, beyond what I've just talked about. We're very proud then that we support a whole network of volunteers, and you have them here in this province as well as everywhere else. About 18,000 volunteers that the agency supports to help these communities that need a helping hand. And about 500,000 tax returns and Canadians are helped through these volunteer clinics. So that's basically the e-story of the agency. I think we've come a long way. It wasn't overnight. It's been years, years in the introduction and the development of it. The technology around security identification, ensuring we have the right person, continues to evolve. I know we were talking a little bit about the passwords that we all need to remember for all our accounts and the frustrations with that. But it's continuing to evolve, and I think the agency, we're in a position of some leadership. Where governments need to go is the tell you once, approach. I think we all know where we would like to be, that in a perfect world, you'd probably have one portal for the Government of Canada. Wouldn't that be wonderful? Where you could authenticate yourself in that portal. It would hold all of your basic personal information, and you'd go through that portal into different rooms. One room if it was in the area of pensions, and another room for employment insurance, and another room for taxes. We're not all joined up yet, and that's a very, the kind of back office work and investment that would be required to provide that frontline service would be extraordinary. But it's a nice North Star. It's a nice place to know that we like to be. As a small part of that, the one business number, CRA gave birth to a business number years ago, and we did it purely for our own reasons. That business number is growing well beyond the agency because increasingly across the Government of Canada and across a growing number of provinces, others are finding that it's efficient to make use of this same business number. If you're a small business person, the extent to which you have one business number that you can use for all kinds of government programs and services is helping you as the client. So that's really it. My closing remarks on this, I don't know where I am on time, on this is that I have a lot of passion about service and service delivery, and it's why the Revenue Agency is a wonderful place to be, because we are in a position of strength and leadership here. We all have challenges in service, and I think as we talk about public service renewal and changes to our organization, if we look from the outside in, we're always in it. That's always the right way to look at how we renew ourselves. We need to look at what we're doing from the standpoint of the taxpayer or the client or the customer, and what their experience is and what's working for them. And if we use that, we can use that, I think, to drive the kind of needed changes we can in our organization. Well, thank you very much. I look forward to the questions.
Thank you very much, Andrew. Next up, we have Donna Kelland. Donna has been Assistant Deputy Minister in the Government Services Branch with Service NL since 2004. Service NL is a single-window service delivery model for a wide range of government-to-citizen and government-to-business services, including a network of regional government service centers delivering public safety, environmental health, environmental protection, development control, fire and life safety, and buildings accessibility plan reviews. The branch also includes the motor registration division, vital statistics, and government's internal printing and microfilm services. Donna is currently a provincial co-chair for the National Public Sector Service Delivery Council and is a member of the board of the Institute for Citizen-Centered Service. Both of these organizations are focused on research and project development and information sharing among the jurisdictions to foster excellence in public sector service delivery across Canada. So she's got a wealth of expertise and experience. Please welcome Donna Kelland.
About the expertise part, but I'll try. Thank you very much, and thank you for the invitation to come and speak with you folks today. Just for the record, I have filed my taxes online, and for the first time ever, before midnight on April 30th, so 2 weeks early. I've used a traditional PowerPoint. I just find it easier to speak to, so you'll forgive me. It's a bit of a passe technique these days, but anyway, we'll work our way through it. The approach I took with this, Service NL, as we've mentioned, is a multi-function organization that delivers services on behalf of 6 to 8 government departments. So we're kind of the front-facing organization for a lot of government services, not all by any means, but we find that it's helpful to clients to have one place to go, the one-stop shopping model, if you will. When I went to look at e-services in government, of course, started with our own services that we have. And I'm just going to run through sort of a rolling pattern of services here, give you a bit of flavor of the types of services that are available online. I didn't include information services, the whole website piece. There's a lot of information on the government website that is available, but I focus more on the how can I do a transaction with government services. So I'll go from there. If I press this button, will it work? Oh, okay. Which one? The button to the right. Good. So, starting with Service NL, one of our major services to the legal community and to the business community is what we call Companies and Deeds Online. It's been in effect since 2005, I think. So we start with the Registry of Companies. There's a number of services that you can use. If you want to start a business, you can search for a business name. If you want to register your business, you want to file articles of incorporation. And so all of those things that businesses traditionally have to do on an annual basis or when they start up can be done online. The Registry of Deeds, we've got, the legal transactions of properties going back to 1980. Of course, the Registry of Deeds goes back to the 1800s. We've only gotten back to 1980 so far online. There is a major project on the go that we'll see a lot of those records digitized over the next few years. So as time goes on, you'll be able to go further back into time, if you like. A number of other registries. Registry of Condominiums, if you want to buy a condo, you can research those type of records. Registry of Cooperatives, Mechanics Lien Registry, that's liens on real property if somebody has problems getting paid for their work. So all of those registries fall under the Companies and Deeds Online e-services. There's also Personal Property Registry, which is a combined registry of the 4 Atlantic provinces and 2 territories, Nunavut and the Northwest Territories. That records financial interests in personal property, cars, boats, appliances, those type of things, so that if somebody owes money, you want to look to see whether or not there's any security on that particular piece of property. That's an online service that you can use. Also under provincial legislation, there's a requirement for lobbyists to register. And so there is an online registry of lobbyists that you can check to see who is in the business of lobbying the provincial government. Then my own home in motor registration. I'm very proud of motor registration, believe it or not. In spite of the lineup outside the door yesterday morning that you might have seen tweeted, I'll speak to that in a second. We have a small number of online services, but very high volumes of participation in those services. So our automobile dealers web allows automobile dealers in the province to do registrations of their clients' vehicles online. So when you go to buy a new car or a used car, you don't have to come over to motor registration. They will register your vehicle for you on the spot. So it's very handy for them in terms of a sales promotion. It's also handy for the buyers. You might be, I hope, familiar with our online vehicle registration renewal. Those of you who have vehicles and are required to register them every year. Very simple. We've actually removed our PIN requirement now, so you can go online and it's very simple to renew your vehicle. We still mail you out your stickers for your license plate, but the actual transaction of renewing your registration is very simple. I'll speak to the tweet, and interesting that somebody was there yesterday morning and tweeted the lineup outside the door at 9 o'clock. Well, a lot of people procrastinate for some reason or another, and so the end of the month on a Monday morning or a Friday afternoon, we get very busy at motor registration. Interestingly enough, a lot of those people, including the person who tweeted, was there to renew their vehicle registration. Could have done it online, didn't have to wait in line, didn't have to wait on an hour to get their stickers. Yes, they have to wait to be mailed their stickers, but you can print off your receipt if you're stopped, show the officer your registration renewal, and you're good to go. So I'd encourage you to think about that next time you have to register your vehicle. Right now we have about 53% of our vehicles renewed online, and there's about, I don't know, 300,000 vehicles, personal vehicles in the province that are registered. There's actually a total of over 600,000 vehicles of all sorts. So some of us have more than one vehicle, I guess. That target, we had actually started off a number of years ago, I think around, I want to say about 10 years ago, with an online renewal process. We hovered around 20%, 17, 20% for a long time. Back in 2007, 2008, we introduced a discount of 10% as an incentive to try and get people online. That worked very well. We ended up almost 67% year before last on average in terms of our renewals. Unfortunately, for fiscal reasons, we had to drop the discount last year. Overnight, there was a drop to about 45%, which, like, again, a little bit curious considering if you're used to dealing online, why you would go back to the traditional model of waiting in line and things like that. We have recovered, however, somewhat, so we're encouraged that people still want to do business online. While you're renewing your vehicle registration, you can also change your address. I don't know if you know, but by law, if you move and you have a driver's license or a vehicle, you have to notify the Registrar of Motor Vehicles within 10 days. So this is an easy way to do that. What we'd like to be able to do eventually is be able to communicate that change of address to other parts of government with your permission. So we're working on a broader change of address service, but this is an easy way to change your address for the legal requirement that we have. And if you want to take a road test, you can pay online. We haven't quite gotten to the process of being able to book online, but you can call our Teleservices Center for Motor Registration and book a road test over the phone. So we're halfway there. A new service that we've offered through Vital Statistics over the last few months is applying for your birth certificate online, or your marriage certificate, or a death certificate. So now, instead, again, of having to go into the office, a lot of people, we issue about 40,000 birth certificates a year. And these are mostly used for identification purposes for other government programs, applying for passports, those types of things. So again, we've tended to focus on the very high volume transactions that we do to try and move them online as much as possible. And for business owners that have to have gasoline tanks, service stations, bulk storage, there's a new service now that we're partnering with the Department of Environment and Conservation to be able to do tank registrations online. Again, these are fairly high volume, frequent transactions that we do at the provincial side. So I looked around other departments. Finance, for example, you can file your business taxes online. There are tax clearance certificates that various businesses and individuals need. Then you go to the Department of Justice, the Judgment Enforcement Registry. They can do searches. You can actually register judgments, and you can get access to search and seizure and sale forms through the High Sheriff's Office. Also, a support enforcement web portal for people that are involved in that circumstance that can be used to register, as well as for external users to find out whether somebody's registered for support payments that they need to make. And provincial and Supreme Courts have e-filing services for their various types of small claims court, probate, and administration filing. We move to environment conservation. You can now pay for your Crown Lands accounts online. So if you have a lease to occupy, or license to occupy, or Crown grant that you have to pay for over a period of years, you can actually do that online now instead of having to send checks and instead of having to maintain those accounts in a paper format. They also have a great online service for maps that are various, now I'm not a technical expert, but various scales of maps and various types of maps, roads, communities, all kinds of interesting stuff when you start going in and clicking around like I did the other day. It's a pretty neat little function. Parks and natural areas, campsite reservations can be made online, and I just found out from my colleague that 91% of all campsite reservations in the province are done online. The other 9% are done through their call center. So convenient way. Now you might still have to line up at Butterpot Park, but at least you got your reservation. So next time you're thinking about going camping, there are online services available. And wildlife licenses. Everybody knows that in Newfoundland and Labrador, big game license, big game hunting is a big thing. You can now apply for your big game license online. I understand you have to get an accreditation. I'll talk about identity management and authentication in a minute. But once you have that, you can use that service to apply for your licenses and to track where your, oh, sorry, that was not a pun, to track where your license is as opposed to tracking where the moose is. But other things like guide license renewals, trapper's licenses, and license returns. So I understand, not being a hunter myself, that when you do catch your game, you have to send in a form or something to say that I've got it and here's what happened. And advanced education and skills, there's somebody here from there. Your student aid accounts are online. So those of you who are at MUN and using student aid services, you can create your account, you can apply online, and you can calculate your eligible amounts for your grants and loans. And I understand that that's pretty much the only way that you can do that these days, but I stand to be corrected on that. Also, with advanced education and skills, income and employment support payments, there's a service that allows clients to repay overpayments online, as well as to report regular income. Some people who use income support also have income periodically, and so they can use this tool to report that without having to call, without having to go and visit, and things like that. And again, a few miscellaneous ones: the labor relations agencies, labor standards, clearing certificates for businesses, and the online minerals claim staking. So if you want to go out and prospect for gold or nickel or anything else, you can do that online as well. Stake your claim, update the maps, and those type of things. So that's a bit of a flavor for the types of services that are available currently in terms of transactions online. Obviously, there's a lot more we would like to be doing, and I think various departments over time are working with the Office of the Chief Information Officer. I brought my colleague Jamie here to back me up in case there's any technical questions, because I'm pretty much a Luddite, and those of you who don't know what that is, you're too young. So I wanted to talk for a couple of minutes about some of the challenges, because as much as we would like to have as much as possible online, it's not as simple as just saying make it so and it's done. Cost of development, it can be high. And those are things like human and financial resources, making sure security is proper so I don't end up getting into Andrew's tax account. Privacy issues, the same thing. Back-end integration, and particularly with some of our older systems, our legacy systems as they're called, and our individual systems, can be a challenge at times. I know we've got a significant database within our system that we use for our licensing and permitting systems, but it's very expensive to integrate online services with that back end. So we're looking at creative ways or new ways to facilitate that. And of course, I couldn't resist. If you can't read that, on the internet, nobody knows you're a dog. That's an old cartoon from the New Yorker, goes back many years. But identity management and authentication is a significant challenge. How do you make sure I'm talking to the right person? How do I give you those credentials so that, you know, even though it may only be once, I know with my account, and we talked about how the challenge I had with not losing my accreditation that you did send me, but making sure you've got that right, and then it's there forever, or it's there until you change your password and then forget what your password is. But there are different levels of systems. So if you're just looking for information online, we don't really need to accredit you. We can just say, here, sign up on the website. If you're looking for certain types of information, we may want to restrict that a little more. So we might give you a user ID and a password. Then you get into the really personal information, like your tax information, possibly your health information, and those type of things, where we really want to be sure that you're the only person that has access to that account. That's where our friends at the OCIO come running to our help. And Jamie and I have been talking of late about working on a corporate basis to look at how we build those systems and how we facilitate or simplify those systems, but still make sure that they're secure. When you have online services, people can use them 24/7. Well, we don't necessarily always have somebody at the other end of a support line 24 hours a day. So that's another challenge for those of us that do offer services. Motor registration is an example. If you run into problems with the website, our web support is limited in terms of the time we have people available. Of course, mobile applications. I don't tweet, just to be honest, but a lot of people do. How do we move from even the web-based services into more mobile applications? I know a lot of provinces are doing work on that. We haven't, at least from Service NL's point of view, gotten quite that far yet. How do you encourage uptake? Is it the field of dreams, build it and they shall come? As I mentioned, we have a service available. If only 50% of people are using it, it sort of does beg the question as to why the other, and it's like Andrew says, not everybody wants to be online. Not everybody can be online. But there's a lot of people out there that possibly could be. How do we encourage that uptake? So those are challenges. I told a little story about, some of you may remember that a few years running we had a discount for renewing your vehicle registration online of 10%. That cost us a bit of money in terms of the loss of revenue, but it did drive up our participation rate significantly. Unfortunately, as I mentioned, once we ran into some fiscal issues, we had to drop the discount. Of course, participation dropped off. So it's a bit of a challenge to figure out how else to encourage people to take up online services. And then, as Andrew mentioned as well, we still have to maintain our other channels. We have government service centers around the province. We have 11 offices and some outlying satellite offices. There's a lot of people that need to use those in-person services for various reasons. Once you move beyond transactional services and get into what I might call the type of service where you really need to talk to somebody, where you really need personal assistance, that has to be available as well. And we still have to have telephone support. Interestingly, national research has shown the telephone is by far the way that people want to communicate with government. I think it was up around 74, 75% of the channel of first choice for people. So telephone systems, contact centers are still extremely important systems for service for people. And again, I go back to security and privacy issues as being significant challenges from the point of view of making sure we get it right and that we protect your information. Opportunities. E-services are much lower cost channels to operate, not to develop necessarily, but certainly to operate. And we're working with some national partners on looking at just what those costs are in compared to other types of channels like telephone and in person. There's great opportunities to work in collaboration with other partners. So internally within the provincial government, we work with other departments and agencies. What are you doing? What am I doing? Can we work together? Can I copy what you've done? Collaboration across jurisdictions. I'll speak about the national efforts in a second, and what I call R&D or rob and duplicate, which is why should I reinvent that wheel if you've already done it and if you're able and willing to share. So mentioned in my little introduction there that I'm a member of the Public Sector Service Delivery Council of Canada. There's also Public Sector CIO Council, and we work together as joint council. So I think almost all jurisdictions, including provincial, federal, territorial, and municipal. So it's a unique group from that point of view because most national organizations are FPT, but we also work with municipal service delivery organizations across the country to share information, share ideas, work together on projects. And some of the benefits that we've gotten here in this province in terms of service bundling and online services have germinated as ideas from those councils, which is great. The Institute for Citizen-Centered Service is functions as a secretariat to those councils, but is also a focus point for research and development. A number of research projects. There's a Citizens First series, which periodically, every couple of years or so, surveys citizens across the country. What types of services do they want? How do they want their services delivered? How do they think service delivery is performing? taking care of business is a similar type of study on the business side. And then I've just mentioned a couple of studies here that we've done recently in the e-service, in the mobile service delivery piece. So I'm sure they'll be available for anybody who wants to reference them. There's some really interesting information in these studies. That's what I've got to bring to you today, and happy to entertain questions in consultation with Jamie. Thank you.
Thank you, Donna. So now we're going to attempt a new e-service. We've never zapped somebody in through the web back to the web, so we're going to get Michael set up. And while John does that, we have evaluations for today's session. If you wouldn't mind, before you leave, when we're all done, just to take a couple of minutes and fill one out. I say a couple of minutes, it only takes a few seconds actually. Grab a few more.
Oh, yeah, there you go.
Hello, Michael?
Yeah, now you can hear me.
We can hear you now, yes.
Yeah, and thanks so much, John, for setting me up.
So, everyone, this is Dr. Michael Jong. He's a rural physician in Labrador. He's the Vice President of Medical Services for Labrador Grenfell Region Health Authority and Professor of Family Medicine at Memorial University. Dr. Jong's passion is in rural and remote medicine. He served as the President of the Society of Rural Physicians of Canada from 2006 to 2008, and he's currently the Vice President of the Canadian Society of Circumpolar Health, and his research is on circumpolar health in rural and remote areas. Please welcome all the way from Happy Valley-Goose Bay, Labrador, Dr. Michael Jong.
Well, thank you very much, and thanks to Andrew. I think the CRA is very important to us. Without CRA, we would not be able to do what we are doing up in the north. And it's the taxes he collected that allow us to do what we do. And thanks so much for that. I do not know how to file tax return. My wife does it for me, and so I depend on my team to deal with that. And Donna, the e-services I use a lot. I hunt, so I do file through e-services my guide license too as well. So I'm a fisherman guide. So if you come to Labrador to fish and guide, I'm a licensed guide, besides being a doctor too as well. And thanks so much for this opportunity to share with you what we do up in the north. I think e-services has been very important for those of us who live in rural remote areas, because it's very hard to get to a center, and there are always a limited number of people out there too as well. What I'd like to talk to you is about telehealth, and telehealth has been and as Andrew suggested, and that Newfoundland and Labrador is being one of the pioneers in telehealth, and this is through the work of Dr. Maxwell House, who is a former lieutenant governor. I appreciate the work that he introduced me to telehealth and brought me on and taught me, and now he's gone and continue his work up here. It's a godsend for many people that lives in Labrador. So I'm going to show you a PowerPoint, and I'm going to do what Donna did and try to put a PowerPoint for here. All right. So I hope you can see this. I can't tell whether you can or not. This is geography. This is Happy Valley-Goose Bay. I don't know if you can see my arrow here. And then the population, the region we serve is a huge area, the size of Newfoundland, Nova Scotia, New Brunswick, and PEI combined. So it's a huge geographic region with very few population. The population of Labrador is only about 30,000. And here's on my light is where I am, and here you are right down here where there are lots more lights and where there are a lot more people. And so we serve an area that's geographically very dispersed. And these are the communities that we serve, and Happy Valley-Goose Bay is here, and there are a lot of Aboriginal population that lives up here in the north. These are the people that we look after. They're wonderful people. It's the kids. This is in Shehaji, and this is Inane. And we travel around still right now on Skidoo. I still see there's still a lot of snow where I am. This is how we fly. There's no other way to get up to those remote communities except to fly. Yes. Yep. Can you hear me?
Yes, we're having a trouble seeing your PowerPoint though. It's stuck on the first screen.
Okay. How about now?
It caught up all of a sudden.
Okay, so that's how we're gonna do it.
Jumping back a few slides, we missed the opening part.
I'm sorry. So
Thank
quickly
you.
flip through it. So these are the kids we see. I'm gonna make it bigger. I try to do it this way. And this is Nain, and we fly with the Twin Otter. So this is when we fly north. This is what we see. A lot of areas where there's no one around. And when we get to the places, this is Nain, our most northern community. You see the airstrip. It's running north and south, hills on the side, so travel is quite dangerous. And we suddenly lost a doctor, a nurse, and 2 pilots when a plane crashed picking a patient up. So we know this is a dangerous part of our work. If you think of trying to land on the airstrip and with the wind blowing from, usually it was strong westerlies, and I've seen planes go off the airstrip too as well, blown off the airstrip. Now the issue about, of course, in most rural and remote areas is mortality is much higher, and the further one lives away from the city. It's mainly in trauma, where it's the rates of rural Canada. More people die from trauma, double that of in urban. Suicides are higher, of course, too, as well in rural areas, and particularly if you look at our population, some of the communities here in Labrador, they are actually 10 times that of Canadian average. And of course, with the higher rates of circulatory disease too in rural areas, but it's not so bad compared with urban. Indigenous health issue is big in Canada. First Nations men and women have a shorter lifespan, and lots die from circulatory diseases and injury. And most of people die young, from 1 to 44. And so, of course, the suicide rates are high in the Aboriginal population, and therefore they die young that way. This is about equitable health, access to health care. Because the geography is difficult, and certainly it's something that I think we need to address, and telehealth offers one of the solutions. The issues is not just unique to Canada, it's very global. It's everywhere, right across the globe. And same for Indigenous health issues, same for people living in remote areas. People die younger, and mortality is higher. So I talk about telehealth as one of the solutions. It's an opportunity to provide better access and reduce the cost for the society. So it actually saves us money. So it saves Labrador Grenfell Health, it saves the provincial government, it probably saves the federal government money because we provide telehealth. Federal government money because they provide funding for Aboriginal population. One of the challenges for us, of course, adoption of technology. Just like Donna mentioned about why people don't use e-services when they're so easy to use. Is somehow, for whatever reason, adoption of technology is very slow. What we currently use telehealth for in Labrador, it's almost a whole bunch of stuff. I just remember a surgeon coming to me the day after his clinic. He said he saved $10,000 for Labrador Grenfell Health because he saw over 10 patients by telehealth, and so patients do not have to come to see him before surgery. So they come to see him on the day they're ready for surgery. So that saves the healthcare system a lot of money. The cost of travel from Nain to Goose Bay is close to $1,000 for a return trip. We do tele-oncology, so patients now in our region can access oncology services to telehealth. We provide chemotherapy here locally in consultation with oncologists remotely. We do telepsychiatry even within our region. It's a day-to-day. It happens every day, and it happens between Goose Bay and the remote communities, and it happens between in St. John's, a referral or tertiary care center, and patients here. It's very useful, especially when we don't have child psychiatry, to have kids seen through telepsychiatry. We allow patients can get dialysis now remotely, and because there are a lot of consultation done every day, when on a daily basis, it's done to telehealth. And of course, we deal with emergencies. And I'm going to spend a bit of time talking about what we can do for emergencies. Andrew mentioned about the robot, and this is what it's like. This is Rosie up in Nain, and Pat Crowley is our nurse in charge in Nain. So Rosie can roam around, and this is a patient I'm seeing, and you see consults nurse, and she's doing ultrasound for me, and I can see what's going on in the belly, and to Rosie, and I can tell from the ultrasound that there is fluid. That's why his belly is so big, because he got ascites, he got fluid in the tummy. And from there, I can make a diagnosis, and we can decide on treatment and follow up. So patients do not then have to travel. In the previous, otherwise, in the past, patients who have to travel, if they come up to see me, even for 15 minutes, it means it's a 3-day travel for them. And so it saves patients a lot of travel and saves the healthcare system a lot. We do put learners out in the remote communities now, because what we're trying to do is allowing to learn how to look after patients in those remote communities, and we've been very successful through the NOFAM program in training our physicians in Labrador, and most of the physicians that we have in Labrador train here in Labrador. 80% of our trainees are working in rural remote Canada. So we're training a lot of physicians, and now if I go travel across Canada, we've been doing this for a few years now, for more than 20 years now. Most of them there are lots of them out in rural Canada. So when we have learners in the remote communities, I can review the charts quite easily with Rosie. You can see on the screen, hopefully, how easy for me to see the notes. And I can just review the notes with them and see the patients together with them. Just like it's one of the learners up in Nain, and he was seeing a patient, and I can see the patient together with him, and then we can review his notes afterwards. This is a CBC story about, I think it's in 2011. So a robot named Rose is helping people in the north coast of Labrador receive healthcare services at their home. Hopefully you can just read it. Hulda was one of my patients, and she says, I'm really happy. I was talking to Dr. Jong. I'm staying here in Nain instead of having to go to Goose Bay. So it saves them travel. For me as a physician, this is no different than being in the same room as the patient, because I can move around. I can even see do an ultrasound remotely. I can check on the pill bottles, and I can help them even in emergencies. We did have a formal evaluation done by a third party of the impact of robotic telemedicine in the remote community. So it says basically improve access to physicians, improve management of urgent or emergent cases, improve mental health assessment, improve personal interaction between nurses, patient, family, and physicians. It helps improve collaboration among healthcare team, improves all our job satisfaction, and reduce a lot of stress for the nurses and all the other and patients also in the remote communities, knowing they can have access to physician anytime. And of course, it reduces costs for medical transportation. So this is part of our day-to-day practice now. What's not very well known yet so far is that it's possible to save lives in remote communities through telehealth. Even though this was published in 2010, I don't think many other people are doing it. Although I do know that because of a previous presentation I did in Australia, that one of them who came back and saw me, met up with me when I went back to Australia a year later to say, Dr. Jong, thank you very much for this because I just saved a life last week and doing telehealth. And so I'll just show you basically that's how we did it. So we can lead resuscitation remotely. You'll see here in this picture, there's Rosie, and this is actually one of our trainees who is trying to, and of course we're teaching our trainees how to do this and how to use robotic telemedicine remotely. And so there's resuscitation, and we can just lead it. So if it's no different than if I'm in a room, because as a physician, I'll lead the resuscitation. My team is the one who does all the resuscitation. And with Rosie, I can actually see the screen a lot clearer without moving too far because the camera can zoom in and out to the screen, and I can see a lot better with Rosie than I can in person. The image, the clarity of the image is much better, and I can do a lot of things a lot faster. This is 2006 when I first, out of desperation. This is 2006 when we had a person who got shot in the chest, and he had no pulse. He was not breathing, and so for all purposes, he's dead. Out of desperation, we're lucky we got telehealth. We hook him up, and this is what happened. So what I was trying to do was teaching the nurses how to put a chest tube to drain the air that's leaking out from his lung, so he can breathe. So he can, and walking them through it to put a chest tube in the chest and so that started at just after 12 midnight, and that video was taken when things were a bit more settled, roughly about 4 a.m. in the morning, and by 6 a.m. in the morning, this is my crew up in Maine, and they got everything all stabilized. They got tubes everywhere, and the patient's alive. The blood pressure's back, and his heart's beating strong, and he's breathing fine, and this is my proud. I'm so proud of the way my team out there that they managed to do this. And from there onwards, we've been saving lives on a regular basis in our remote communities using telehealth. Where do we go from here? There are always new things to continue to explore. One is, is chronic diseases is a big issue nowadays in all over across Canada and globally. And so one research we're going to embark on is how we can use telehealth to improve our care for chronic diseases. And this other issue we would like to embark on is how to use social media to prevent suicides, because we know that a lot of our patients are using social media. They're tweeting or they're Facebooking about the issues and about them wanting to kill themselves. And we feel that social media is one of the ways that we can reach out and we can actually provide help. And so those are the future research that we're embarking on. So telehealth is almost like it's a perfect computer that's been developed. You feed in your problems and they are sorted out. They don't come back out again. A lot of innovation we do up here, it's not really from pure research or from science, but how pissed off we are that we're not able to do something. So we're out of desperation. We end up with some innovation or some. And Chinese word for crisis, wei ji, it means every time it's a danger, there's opportunity. And here is Rosie is one of the opportunity that cropped up, and this is very much part of the team. Next is one of the newsletter from the Newfoundland and Labrador Medical Association. It says robotic telemedicine improve patient outcomes. 20 years ago, the only place you can expect to see a robot racing down a hospital hallway to respond to a medical emergency was a science fiction films. Today, it's very real and helping to save lives in remote communities. So this is where we are at here now, and so I thank you very much for the opportunity to talk to you about this. Let me see if I can get out of this back.